Hey YouTube, welcome back to Intuition. So in today's video I want to help you guys out with some tips on how to give the perfect presentation and how to get an A on your seminar. So when it comes to giving a good presentation, it's no different from writing a good essay, which I'm sure most of you have experience with. And it's no different from giving any good presentation on any topic, right? Pharmacy is just one topic out of many. The key is to give a clear and coherent message. That means to give a message that's clearly understood to just about anybody. And by coherent, it means that it is a message that is consistent within itself, which means that there's no contradiction to the message. So you want to give a very clear and coherent message. And giving a clear message is about letting your audience know who, what, where, and when. And let's start off with who. You need to let your audience know who you're focusing on. For example, you could be doing a topic on pediatrics, or maybe you're doing a presentation on older population, which would be the geriatric population. Or maybe you're doing a study on women's health, which means that you're doing a study on the women population. So you want to let them know, for example, hey, I'm doing a presentation on women's health. And also you want to be very specific. Who are these women that you're studying? So you can say specifically, I'm studying women who are taking estrogen birth control. So this would be the demographic with which you're concerned with. Now it comes to what? What is going on with this population? So you can let your audience know, hey, this is what is going on. Women who take estrogen-containing birth control are at a higher risk for developing blood clots. Estrogen-containing birth controls increases the risk of developing DVTs. So that's the what. Now it comes to where. Where does this happen? Is this a local phenomenon? Is this a national phenomenon? Or is this a global phenomenon? So you need to be specific about where this incident is occurring. And this is important because this can help expose confounding variables. For example, if you were doing a study on women in China who develop DVTs who are on birth control, you can introduce confounding variables because the smoking rate in China is very high. And smoking also puts a person at high risk for developing blood clots. So you want to be specific about where. And you also want to be specific about when. When does it occur? Because when something happens is a big factor when assessing causal relationships. On average, how long does it take for these women to develop blood clots after starting your estrogen-containing birth controls? Does it happen within days, within weeks, months, years? Okay, so you want to let the audience know when also. So who, what, where, and when. Be very specific about what your topic is and make sure that that message is clear about what you're going to be talking about, okay? The last thing you want to do when giving a presentation is to ramble. It sounds like you didn't prepare and that you don't know what you're talking about. You're just talking just to talk. If you do that, chances are you're not going to get a good score. Because when you give a good presentation, you want to be very precise about what you're saying, and everything that you say needs to lead you into the direction of your conclusion. So it needs to be coherent, okay? So after doing a good job of letting your audience know what your topic is and what the interest of your study is, then you want to let your audience know what is currently being done about it. This means that you want to let the audience know what is the current standard of treatment for the disease that you're talking about. These women are developing blood clots. What is being done about it? What's being done to prevent it? What's being done to treat it? This is where you need to become very familiar with the guidelines for the disease that you're studying. For example, when it comes to the DVT and the blood clots, the CHEST guidelines is the main guidelines that determine the standard of treatment for blood clot treatment and blood clot prevention. So you will need to know the CHEST guidelines up and down. So know the guidelines front to back, okay? Now, after letting the audience know what the current guidelines for this disease is, then you want to introduce the heart of your study, which is basically you want to introduce change. Because if the guidelines were perfect, then there would be no point in doing a presentation, right? So the whole point of doing your presentation is to determine how you can add change that will lead to positive effect. So currently the standard of treatment is not doing a great job, or maybe it is doing a good job, but there can always be improvement. And you want to let the audience know how it can be improved. And this is where you dive into the heart of your study. And for pharmacy seminar, the heart of your study will be your literature search. So before you give your presentation, you want to do a very good job of going through the literature and making sure that you read as many articles and as many studies as you can about the disease state that you're presenting on. You want to deliver a message of change that will lead to a positive effect with less women developing blood clots. I don't know how long, different schools, I don't know how long your seminar has to be. When we gave seminar, we had a time limit of 45 minutes. So that gave us enough time to present about 2 to 3 articles. Dive into the literature and pick the best articles that you can find. And you want to know your disease, and you want to know your disease state up and down. So you want to know what the pharmacotherapy is and what the physiology of your disease is, because these 2 things are going to be tied together, and you definitely want to make sure that your audience have a very good understanding of what's going on. The heart of your presentation will be the articles that you choose to present. So therefore, it is imperative that you know how to analyze articles, because articles and studies are at the heart of medicine. Medicine is evidence-based, so you have to develop the skill on how to read an article and assess the evidence within the article to implement change. When it comes to analyzing an article, the basis of analysis is statistics. So you got to know your basic stats, okay? Statistics is at the heart of medicine. Statistics is at the heart of science, because you can't know anything perfectly. You can only know something to a certain level of precision, and statistics is the tool that we use to analyze the precision with which we know something, okay? So you gotta know stats. And when it comes to the stats, the 2 main things you wanna look out for are bias and statistical significance. So let's start with bias. Every study has bias. Instead of studying the entire population, we study a small chunk of the population, which we hope to be representative of the entire population. So right off the bat, every study is gonna have bias. So if you're asked the question, were there any flaws in the study? Your answer should never be no, the study was perfect. Every study is flawed. So a study that chooses its study population randomly is going to have less bias than a study that selectively chooses its sample. So you definitely want to be looking out for bias in the control and study group. That's going to be huge. The next statistical consequence that you want to look out for is statistical significance. Statistical significance is arbitrary. It's whatever you define it to be. In medicine, for the most part, we choose statistical significance to be a p-value of less than 5% or less than 0.05. If your p-value is 5%, then roughly that means that you're about 95% sure that there's a real difference between your control and study groups. So a p-value of less than 0.05 is typically the standard for statistical significance, but you need to know that that's arbitrary. And of course, when it comes to statistics, you need to know the different statistical methods that should be implemented. For example, if the outcomes that you're looking at are categorical outcomes, you're not going to be using the t-test, you'll likely be using a chi-square test, right? So you need to know the difference between your continuous data versus your categorical data and what type of statistical tools should be used to analyze those type of data. And after you do a great job of presenting your studies and analyzing the data of the studies, then you want to move on to your conclusions. And now when it comes to the conclusions, you don't want to just repeat what the author said. You want to show your graders that you're thinking critically and you're not just following what the article says. The goal is supposed to be for you to become the expert, and you're going to be an expert at being able to analyzing data and implementing change. That's basically what you're going to be doing as a healthcare professional. Now, of course, the authors are also healthcare professionals. They're going to reach rational conclusions most of the time. So a lot of your conclusions will be directly in line with the author's conclusion. There's nothing wrong with that. But you also need to make sure that you put your own thoughts, and your own conclusions into your presentation. For example, statistical difference is not everything. For example, I remember reading an article on a new inhaler. This new inhaler was compared to an older asthma medication, and they were compared in terms of their ability to increase FEV1, which is the amount of air that an asthma patient can blow out. This inhaler increased the FEV1 by 15 milliliters, and it was statistically significant. But here's the thing, 15 milliliters, that volume is so small, it's like, it doesn't even matter. That was the improvement, 15 milliliters of air. And the new asthma medication costs like $200 more. So you don't want to just look at statistical significance. You also want to consider clinical significance. Is that a real difference in the clinical setting? So you want to use clinical judgment when giving your presentation. So a big part of coming up with your conclusion is having the ability to weigh cost versus benefit, because the Hippocratic Oath for healthcare professionals, and you as a pharmacist, is to do no harm, which means that safety comes first. If drugs didn't cause harm, there will be no point for pharmacists. Every drug would just be available over the counter. Drugs cause harm, and there's no perfect drug. Every drug, if taken to an extreme amount, is going to cause harm. No drug is perfectly safe, and you want to constantly weigh the harm or the cost versus the benefit. And that's you using your clinical judgment to reach that conclusion. And of course, other factors that will impact your conclusions would be drug costs, because drug cost is going to impact the drug adherence for your patients. Patients are going to be less likely to fill prescriptions that they can't afford. So drug costs and side effects for sure, because side effects, if patients have too many side effects from a medication, they're less likely to take that medication. So go out there, read a lot, learn a lot, and put together a coherent and consistent message. And I guarantee you're gonna ace your seminar. All right? So let me know if that was helpful, or if you guys have any questions about how to better prepare to give your seminar, just go ahead and leave it in the comment section below. If you're new to this channel, go ahead and subscribe, give us a like, spread the message that we're out here and we're trying to educate the population. Go ahead, keep supporting, and if you have any questions, go ahead and leave it in the comments. And as always, I'll see you guys next week. All right, bye-bye.